Physiology of menstruation. Puberty. Puberty is the period in girls which links childhood to an adulthood. Menarche. Onset of first menstruation in life is called as menarche. Age is 10 to 16 years. Peak time is 13 years. Menstrual cycle. Cyclical events which takes place in the rhythmic fashion during the reproductive phase of woman's life is called as menstrual cycle. And duration of menstrual cycle under normal physiological conditions it is 28 days and which may vary from 20 to 40 days. Changes during the menstrual cycle are ovarian changes, uterine changes, vaginal changes, changes in the cervix, and these changes takes place simultaneously. If we talk about ovarian changes, there is geminal epithelium, primordial follicle, primary follicle, vesicular follicle, Graafian follicle, and after ovulation at the 14th day, it converts into corpus hemorrhagicum, which is to corpus luteum. If fertilization occur, corpus luteum of pregnancy. If no fertilization, corpus albicans of menstruation. And this is how it occurs. Ovarian cycle or the growing follicles, and ovulation takes place on the 14th day, and corpus luteum is released, and formation of corpus albicans if no pregnancy on the 28th day of menstruation. Ovulation. It is the process of rupture of Graafian follicle with consequent discharge of ovum into the abdominal cavity, and this ovum is picked up by the fimbria of the fallopian tube, transported into the tube, and waited there for the sperm for fertilization, and occurs after maturation of the follicles. It is influenced by anterior pituitary hormones called as luteinizing hormone on its peak, which is on the 14th day. Luteinizing hormone is peak on the 14th day of menstrual cycle, which influences the ovulation. And during the ovulation, there is 1 degree raise of temperature or basal body temperature. There is 1 degree raise in the temperature, which can be noticed by careful observation. And process of ovulation is rupture of Graafian follicle takes place at the stigma. Follicular fluid oozes out. Germ hillock is freed from the wall. Ovum expelled into the abdominal cavity with some amount of fluid in the granulosa cells, and from abdominal cavity enters into the fallopian tube. Now let's see about uterine changes. Uterine changes are in 3 phases. They are menstrual phase, proliferative phase, and secondary phase. During menstrual phase, there is progesterol withdrawal bleed. Progesterone, which is the main hormone for the menstruation or menstrual bleeding, is progesterone. It increases, it starts raising from the 14th day of menstruation, and it withdraws after 28th day where there is menstruation, and progesterone withdrawal bleed causes menstruation. And lack of estrogen and progesterone leads to sudden involution of the endometrium. Endometrial vasoconstriction after progesterone withdrawal, those tortuous blood vessels in the endometrium undergo severe constriction. The vasoconstriction lead to hypoxia, which results in necrosis of the endometrium. Vasoconstriction of these vessels leads to necrosis of the endometrium, which results in shedding or start rupture of the endometrial epithelium, and blood oozes out. The outer layer of necrotic endometrium is separated, passed out along with the blood. This outer layer is separated and passed out along with the menstrual blood. Desquamated tissue or blood in the endometrial cavity initiate the contraction of uterus. And proliferative phase from 4 to 14 days. Endometrial proliferation occurs rapidly. The epithelium reappears on the surface. Within 4 to 7 days, and uterine glands start. These are the uterine glands which starts developing within the endometrial stroma. Blood vessels also starts appearing in the stroma, and proliferative phase continues for about thickness of 3 to 4 mm. And after that, secondary phase is from 15th to 28th day. Hormones which influence are progesterone and estrogen. From 15th to 20th day, hormones which affect are estrogen and progesterone. As the glands of endometrium are become more tortuous nature of gland because of increase in the size which exceeds the thickness of the endometrium. The cytoplasm of the stromal cells increases because of deposition of glycogen and lipids. Many new blood vessels appear within the endometrial stroma. When many new blood vessels appear within the endometrium of the stroma. Changes in the cervix. During proliferative phase, mucous membrane becomes thin, which is under the influence of estrogen. Thin mucous membrane is more alkaline for survival of the sperm and sperm motility. During the secretory phase, under the influence of progesterone, mucous membrane become thick and adhesive. Changes in the vagina. Proliferative phase, confined to vagina. Conification of the vagina under the influence of ovarian hormone estrogen. And secretory phase, proliferation of the epithelium, vaginal epithelium, and infiltration with leukocytes under the influence of progesterone, which increase the resistance of the infections. And abnormal menstruation. Amenorrhea. Absence of menstruation during reproductive period of female is amenorrhea. Hypomenorrhea. Decreased menstrual bleeding is hypomenorrhea. Menorrhagia. Excess menstrual bleeding is menorrhagia. Oligomenorrhea. Decreased frequency of menstrual bleeding is oligomenorrhea. Polymenorrhea. Increased frequency of menstruation. Dysmenorrhea. Menstruation with pain. Menorrhagia. Uterine abnormalities between menstruation.